Good morning, everyone. Welcome to the 2025 NAMI conference. Thank you for all joining us as you make your way into the room. We thought it would be a great idea as we kick off another incredible day together to just bring us to this moment, right? Avoid topics about traffic to get you all here. You all have your coffee and your breakfast, and let's get connected and grounded in the day to come. You can participate in this little activity if you like. It's totally your choice, but we wanted to share a little trick that you can use throughout the day, because what we find is as powerful as the conversations are that we're going to have today, as powerful as the connections are that you're going to have today, sometimes when we talk mental health, it can get a little heavy. So we just want to help you find a way to continue to be centered and focused today. So we're just going to do a little breathing technique together. Again, participate if you like. Many of you may know this. Before we kick it off, I'd like to introduce myself. I'm Dawnel DeRubeis, and I help run the NAMI GLAC Warmline. There's information about our resource out on the NAMI GLAC table. So again, thank you and welcome. If you all just want to get comfortable in your seats, we recommend, if you can, have your feet flat on the ground. I love to close my eyes when I'm doing this myself. I'm not going to do that today so that I can kind of show you and walk you through how this works. This is what they call box breathing. We do this a lot with our help seekers that call the Warmline. It's 4 by 4 by 4 by 4. So you're going to breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds. And the recommendation is you repeat that 4 times. And it really helps just to calm things, helps to lift the weight off your shoulders that you may be feeling from, again, driving in here this morning. So if you'd like to close your eyes, you certainly can do that. I recommend just rolling your shoulders back to help relieve that tension. And then you're just going to breathe in for 4 seconds. Breathe in 1, 2, 3, 4. Hold it there. 2, 3, 4. Breathe out. 2, 3, 4. Amazing. Again, breathe in. 2, 3, 4. Hold it there. 2, 3, 4. And breathe out. 2, 3, 4. Breathe in. 2, 3, 4. Hold it. 2, 3, 4, and breathe out. Excellent. One more time. Breathe in. 2, 3, 4. Hold it. And release. 2, 3, 4. Amazing. So good. You can do that throughout the day. I'm going to share with you one more little trick that helps me to just continue to feel centered. You can actually do it on your thigh. All you're going to do is make a little box. It reminds you. Breathe in, 2, 3, 4, hold. And you just make a box on your thigh. Nobody will even know you're doing it in the room. And if that's not enough, you can join me in the Calm Room. I'll be in the Tahoe space. It's just back through the lobby to your left. You can come in there and just get a breather and a break. So thank you so much again for being here. And I have the absolute honor of introducing NAMI GLAC's Executive Director, Traute Winters.
Good morning, NAMI family. It's so great to see all the familiar faces and some new faces here. How about those Dodgers? Did anyone else stay up till midnight last night? Yes, and we can see people are probably still streaming in because they were up late last night. Well, it's my pleasure to welcome you to the NAMI Greater LA County Together for Mental Health Access, Action, and Advocacy Conference. I'm Traute Winters, the Executive Director for NAMI Greater LA County, and it's my honor to serve you in that position. We're honored that you have chosen to be here with us today. NAMI GLAC is made up of multiple affiliates throughout LA County. Who's here from our Glendale chapter? Woo! All right. How about San Fernando Valley? All right. San Gabriel Valley. I see. South Bay. Pomona Valley. Long Beach. And Whittier. I saw Rita here, our longtime volunteer. And we also welcome our friends from NULA and West LA. All right. I'm extremely proud of what we've accomplished this past year. We've really grown tremendously in our programming. We've developed and expanded our programming for people of color. We now have Spanish-speaking programs in every chapter. We've started LGBTQ plus programming, and we're in the process now of starting our Chinese and Armenian programming, as well as building out our TAE programming for transition age youth. So we're really trying to do the best to serve our community, both the unserved and underserved. And as Dawnel mentioned, we have our Warmline, which is available for anyone to call Monday through Saturday. And we have trained peer support specialists with lived experience that will support you. And we have helplines in each of our chapters. We're also very big on advocacy. So we've advocated for jail diversion programs, mental health treatment beds, the expansion of mental health workforce and supportive services and housing for the unhoused living with mental illness. I hope you will join us in our advocacy efforts. Please go to namiglac.org/advocacy and you can join us. We meet once a month and we will train you on how to be an advocate. This conference reflects how NAMI brings everyone together, families, loved ones, clinicians, peers, advocates, all of us together for mental health, which is now more important than ever. We greatly appreciate our sponsors, including Cantor and Cantor, Advantage Healthcare Services, Bristol Myers Squibb, HealthNet, J&J Innovative Medicine, LA Care, Neurocrine Biosciences, Synergy, and Gateways Hospital. Because of their support, this conference is here for you at no cost. Before we begin, don't forget, if you haven't received a raffle ticket, Ira there in the vest who's swinging the raffle tickets, he's happy to bring one to you because we have a really exciting event that is coming up on November 9th that we have Diane. Is Diane here? This is the third year she's putting this event on for us. And you can see on the flyer, we have celebrities like Jane Lynch, Kate Flannery, and it's a really great show at a small venue with Broadway stars. And so we hope that you will join us for that event. But if you win the raffle in the closing ceremonies, we'll pick the number, then you will receive 2 free tickets to attend the event. But we hope you join us. It's a really fabulous event in a small venue that you probably can't get anything at the price with these kind of celebrities. So a few housekeeping items. I want to invite us all to be present. We had the centering moment. Please turn off and silence your cell phones, especially during the sessions. We have a 15-minute break between each session where we can connect with others and check our messages. Bathrooms are located at the end of the hall where I'm pointing. Out of respect for all our presenters, please raise your hand when you're in a session. We will have time for Q&A after each session. We have a lovely lunch by Wolfgang Puck for you, starting at 12:30. And please do our survey after each session. That helps us plan this conference, and we value your opinion. And also, I invite you to stay till the very end, till 4:00 today, which you'll get home in time for the 5:00 Dodgers game today. And we have Ira again in the back, who's going to lead us through ending our day with some laughter therapy, which I think we can use. And comedian Beth May will be here as well. So we want you to leave here today with increased happiness and overall well-being. It's now my pleasure to introduce our keynote speaker, someone whose leadership has transformed lives across LA County. Actually, we're going to do a video first. A lifelong advocate for equity, dignity, and access, she has championed mental health, environmental justice, and economic opportunity with unwavering commitment. As the first district supervisor and former U.S. Secretary of Labor, she brings both national vision and local heart to every initiative she leads. Her work continues to uplift our most vulnerable neighbors and ensure that every voice is heard. So please join me in welcoming a true trailblazer and tireless public servant, a video from Supervisor Hilda Solis. And unfortunately, today is when the Board of Supervisors meet, so they couldn't be here in person. Okay. Let's see, Gigi.
Hello, everyone. I'm Hilda L. Solis, Chair Pro Tem and Supervisor for the 1st District of Los Angeles County. And I want to thank the National Alliance on Mental Illness of Greater Los Angeles County for organizing this important conference and for everyone participating today. As we are all too familiar, our county is facing several major crises, including addressing mental health, substance use, and homelessness. And I want to recognize NAMI for providing a critical voice and being a leading partner in helping us address these challenges. Here at the county, we've adopted a Care First strategy, one that I have been proud to champion at the Board of Supervisors. It has defined our efforts to lead with services and healthcare before more punitive measures and has continued to serve as a guiding principle in my ongoing efforts to close Men's Central Jail in my district. We all know that neglecting care leads to an unending cycle of some of the most vulnerable residents moving from the streets to the emergency room and to our jails. That's why over 7 years ago, I led efforts to create the Restorative Care Village, the first of its kind healthy village on the LA General campus. We are in the midst of setting up a comprehensive continuum of care to address the physical, the mental, and substance use dependency needs of our residents. We already have 2 key services in operation, a 96-bed recuperative care center operated by JWCH Institute for patients with chronic health needs that no longer need emergency care, but are still too ill or frail to recover at home or sadly on the street, and 64 beds of crisis residential treatment on the campus to address the acute mental health needs of our patients. Soon, we'll have a mental health urgent care center, residential withdrawal management facility, and a psychiatric subacute facility, providing the beds that have been identified as being in the greatest need. Everyone in our community deserves access to quality, affordable mental health services. And your continued advocacy, lived experience, and input is critical in informing our ongoing response. Together, we can truly make a difference in the communities that we serve. Thank you.
Okay, I'd like to introduce today's keynote speaker, Dr. Kenneth Wells. He is the David Ball Endowed Professor and Director of the Center for Health Services and Society of the Seminole Institute for Neuroscience and Human Behavior. Professor in the Department of Psychiatry and Biobehavioral Health Sciences at UCLA David Geffen School of Medicine, and professor in the Department of Health Parity and Policy Management at the Fielding School of Public Health. He is also affiliated adjunct staff of the RAND Corporation and staff psychiatrist at the West LA Veterans Administration Health System. Dr. Wells has dedicated his career to supporting individuals and communities through research, teaching, and engagement to improve mental health care. He has been instrumental in developing community-partnered participatory research to decrease disparities in access to and outcomes of care for depression. Dr. Wells has a long history of leadership and innovation, earning recognition and numerous awards for his work in behavioral health and in communities. Please welcome to the stage Dr. Kenneth Wells.
Good morning. It's a pleasure to be here. NAMI Greater LA has been a partner of many of the projects I've been involved with for the last 20 years. And I really fully respect all of the tremendous work that this organization is able to do. So thank you for inviting me, and thank you, Deborah, for working with me on developing these presentations. So today, what we're going to be talking about is an overview of the T1. We'll talk about what T1 is and its potential effects on behavioral health coverage and services, and then how we may work together. So we'll review what's been called the One Big Beautiful Bill Act, OBBBA, or T1, how they affect coverage and services for health systems, patients, and communities. We'll talk about some strategies that may be helpful to prepare for the changes and maintain Medicaid eligibility and services as feasible. And then in terms of making a difference together, that will be basically the subject of the afternoon follow-up session in the afternoon, 1:45 in the afternoon, with representation from different county agencies and so forth, and they'll be sharing their experiences. So first, to highlight some of the features, there will be new work requirements for Medicaid enrollees age 19 through 64. 80 hours per month of employment, job search, or community service will be required, except for some people that have exemptions. We'll talk about that some. And then enrollees must prove their eligibility every 6 months, which is more often, with and proof of residency and Social Security numbers every 6 months. So people have to be able to know when to do that and to have their information and how to implement that. And then there will also be new copays for doctor visits up to about $35, but behavioral health visits will be exempt, but they'll have other costs for other visits to primary care and so forth. There will be a ban on Medicaid reimbursements to clinics that provide abortion or gender-affirming care for minors. And then there will be also limits on provider taxes. That's important because that's what states have been used to really partner with Medicaid and enhance those services. So then those provider taxes will be reduced. So overall changes, the legislation cuts the federal funding for Medicaid by about 15% or $1 trillion over 10 years. The Congressional Budget Office estimates that the cuts will result in 11.8 million individuals losing Medicaid, 3.1 losing Medicaid coverage under market plans, and 4.2 million in market plans themselves uninsured. A market plan includes covered California. So I don't know if you happen to be watching, you were probably watching the Dodgers, but if you saw the news last night, there was a lot of discussion of the covered California going down. And then with expiration of expanded premium tax credits for plans, which could mean that doctors leave covering Medicaid patients or serving Medicaid patients. The legislation implements cuts over several years. We'll go through that, and some on the enactment. So here's the timing review. And I'm sorry, it's a lot of words, but I'll talk it through and hopefully it'll be somewhat clear. January 1st, coming up, sunsets the enhanced federal payment rates, the federal Medicaid assistance percentage, states expanded Medicaid, this expanded Medicaid under the ACA. So that means starting January 1st, there will be cuts in that. October of next year, Medicaid eligibility will be reduced for some non-US citizens. So that will make that change. And then December of next year, states will conduct the eligibility assessments every 6 months. So that's when that every 6 month requirement. So there's kind of a year to prepare, but that will start in a year from December. January of 27, that's when the requirement to do the 80 hours per month of work, employment, training, or volunteering. There are some exemptions for tribal parents caring for children less than 14, medically frail, and that includes those with severe substance use disorder or severe mental illness. It won't include, for example, depression or anxiety, but it'll include schizophrenia, psychotic disorders in terms of being exempt from that requirement. October 28, states will require cost sharing for some Medicaid services. So that'll be a new cost, even if covered. There are some exemptions to those cost sharing: primary care, mental health, substance use disorder, FQHCs, certified community behavioral health clinics, and rural health clinics. So it doesn't affect everyone or every type of service. And then also in October of 28, there will be it lowers the cap on provider tax rates. That's what offers state Medicaid support. So that will be less that the states have available by then. For the background, for this background and so forth, there are various sources that are online that I use to put this information together. And there are 50 copies of this out on the table there. So if you're interested in looking up online, understanding it in more depth, these pages are out there on the table for you. Okay, so that's a lot. What are the potential effects on clients and communities? Access to mental health care and how people avoid losing insurance is one area. We'll talk about it more. LA County DHS may lose millions per year. Cuts to the Department of Public Health and DMH. Provider staff layoffs may occur. I know the counties will talk, particularly this afternoon, but also before then, on all that they're doing to make it work out so that they don't have to do that. But it's a big subject. The county is, as I mentioned, exploring how lost revenue may be replaced. The renewal twice a year, that may mean more lose insurance at each step. So it could be gradual if people don't provide their information or are no longer eligible. There was a recent randomized trial in 2015 that showed that help through text or online live help increased renewals for when their state had yearly renewals. And the change to yearly renewals led to reduced coverage. And now the twice yearly could lead to higher reduction, but increase the importance of things like text reminders and online help available for people to fill it out, especially for people with disabilities or mental disabilities and so forth. So it'll be very important to consider how health systems with Medicaid patients can support their renewal. Effects on special populations. More than 5 million children in California rely on Medi-Cal. 3/4 of those are children of color, primarily Latina and Black children. The T1 cuts to parental coverage work renewal may lead to 10 million adults and children to lose Medicaid by 2034 under the current policy. Opioid use disorder. The T1 may cause 156,000 to lose opioid disorder medications, which could increase fatal overdoses to be seen. On the positive side, the T1 Rural Health Transformation Program offers $50 billion over 5 years for states must submit their rural transformation plans and expenditure certifications by December 31st of this year to access those funds. I don't even know if states know that they have to apply by the end of December to be eligible for these rural benefits. The eligible areas include community mental health centers, opioid treatment programs, rural emergency services, telehealth initiatives, urban teaching hospitals that serve rural populations, and the opportunity for it's an opportunity for organizations serving rural communities. Competition for the funds may be high if people apply, and requiring the use of elements like telehealth and data on outcomes efficiency to succeed. So that's an important area for awareness as well. Changes for behavioral health providers, increased administrative burden due to eligibility checks, documentation, possible copay collection, potential drops in patient coverage, unable to meet work requirements, greater pressure to maintain compliance with the documentation rules, risk of reimbursement instability, limits the amount of Medicaid managed care direct plans to pay providers, and then some states had behavioral health clinicians paid commercial rates. This disappeared under T1. So that level of reimbursement, so providers could leave Medicaid, private providers, for example. Potential impact, Congressional Budget Office estimates 12 to 16 million could lose Medicaid nationwide. California, 15 million have Medi-Cal. California may have 19% cut in federal funding, 164 billion over the next decade. That's based on KFF nonprofit healthcare organizations estimate. Hospitals, nursing homes, other providers will be paid less, could reduce their services, or providers leave Medicaid. California, less federal funds for expansions, undocumented immigrants, for example, adding on to what's occurring now. Medicaid helps California pay for housing and food assistance. The federal reduction will affect those as well. California federal cuts on-site pregnancy care for homeless, antipsychotic medication distribution, and mobile crisis teams will be part of federal cuts. Impact on LA County. LA County is projected to lose $714 million over 3 years, mostly Medicaid cuts, reducing benefits, limiting provider payments, restricting eligibility, could 1.5 billion over 5 years. That's the Davenport report. This could result in county layoffs, possible closure of public hospitals, but they're fighting to make it stay. Context after LA fires, in addition, it cost the county 800 million, and that could increase to 2 billion. So it's, again, stress on the county with the fires as well as this. What can providers do? I'm probably in my little overtime. A minute or two. So, all right, I'll go quick. They can evaluate the budgets and the revenue streams, diversify the payer mix, consider strategic partnerships, upgrade to EHRS and other data systems, centralize data, implement integrated engagement tools, engage in policy advocacy, which NAMI is great in, stay close with state Medicaid offices, association lobbying, Medicaid advisory groups, improve operations, enhance community-based care, streamline throughput, focus on preventative models to avoid crisis, potential action plan, implement credentialing platforms to help people manage their renewals, train staff on the new HIPAA measurement-based care and consent policies that are also there, strengthen audit readiness, upgrade EHR. And then this is just a quick summary, the loss of the million, but also support for rural services. And then other things are cuts to CDC and SAMHSA staffing and services, which will further affect behavioral health nationally. Okay, it needs all of us working together. And then you'll hear a lot how this is being addressed in LA in the afternoon session. So thank you very much. I appreciate your time. Okay.
Thank you again, Dr. Wells, for being here today and for your leadership. We really appreciate it. It's now my pleasure to introduce Dr. Curly Bonds, MD. He oversees all clinical practices of the Los Angeles County Department of Mental Health, as well as the full range of programs that function to engage and stabilize clients by bringing them into the department's community-based system of care. Dr. Bonds is a psychiatrist with extensive experience in a variety of clinical, academic, and research settings. He was the chair of psychiatry and behavioral medicine at Charles Drew University School of Medicine in LA and the medical director for D.D. Hirsch Mental Health Services. His areas of expertise include healthcare disparities, cross-cultural psychiatry, psychosomatic medicine, and collaborative health. Please join me in welcoming Dr. Bonds.
Good morning, everyone. We can do better than that. Good morning, everyone. Well, I'll tell you, Dr. Wells is a hard act to follow. I'm here because our director of the Department of Mental Health for LA County, Dr. Lisa Wong, was called into session with the Board of Supervisors today because we're doing everything we can to sort of respond to the potential cuts that are expected due to the shutdown of the federal government on November 1st. People won't get their food. So we're working with all the county departments to come up with a backup plan. But trust me that she would rather be here, and I'm glad to be here instead of where she is. So I have her prepared remarks, and I'll go through them. And I always like to start, though, if this were my presentation to NAMI, I always like to start with my background. And just to give you a tiny snippet, the way that I came to psychiatry was from firsthand experience. I have a sibling, my older sister, who lives in Southern Alabama, who was diagnosed in her first semester at college with a serious mental illness. And she is still on the path towards recovery. And she is my inspiration. And she is also the motivation for me to continue to do this work so that everybody has the same access to care that she got, which helped her have a very productive life. So it is a true pleasure to be here with you today, advocates, families, peers, and providers. All of us are united by one shared mission: to advance mental health care and wellness to everyone in LA County. I want to start by thanking NAMI Greater LA for the tireless work in building community, fighting stigma, and standing beside people on their recovery journeys. You remind us every day that mental health is not just a systems issue, it's a human one. At the Department of Mental Health, our focus has been to meet people where they are, whether it's in their homes, on the streets, in schools, or online. Over the past year, we've expanded several programs designed to close gaps in access to and to improve care. We've launched the restorative care villages across the county that you heard Supervisor Solis talk about, including the recently opened LA General Medical Center's Restorative Care Village, which will offer integrated physical and behavioral health services on one location. These sites provide a continuity of care, a total continuum of care from urgent care to recuperative housing, helping people transition out of hospitals and into stability. We've also expanded community-based access centers and well-being centers for youth, ensuring that mental health services are embedded in everyday community life. And through our partnerships with faith-based organizations, cultural centers, and peer-led groups, we're reaching people who might not otherwise seek help through traditional systems. Another exciting development is our digital mental health initiative, which leverages telehealth and app-based programs to connect individuals to care faster, particularly important for working families, caregivers, and young adults. We know that the mental health crisis should receive a mental health response, not a criminal justice one. That's why our crisis response system continues to evolve. Through alternative crisis response teams, which include the mental health evaluation teams, or MET, and the homeless outreach and mobile engagement teams, or HOME, we're providing more compassionate, trauma-informed care across all service areas. And our department's 24/7 helpline is fully integrated with our regional mobile crisis teams, as well as the 988 Suicide and Crisis Lifeline, allowing dispatchers to deploy field-based clinicians directly to people in distress and often avoiding unnecessary hospitalizations or arrest. This model is not just saving lives, it's changing the culture of crisis response in LA County. As many of you know, Senate Bill 43, which updates the state's conservatorship laws, expands the criteria for grave disability to include those unable to meet their medical needs due to serious mental illness or substance use disorder. Our department is working closely with the Board of Supervisors, the Department of Public Health, and service providers to implement the new law. On January 1st of 2026, in a way that protects civil rights while ensuring timely care for those who are most vulnerable. At the same time, we're continuing to inform the community about the CARE Act, the Community Assistance Recovery and Empowerment Process, which provides a civil court pathway for individuals with schizophrenia, spectrum, or related disorders, connecting them to care plans that emphasize voluntary engagement and accountability. And we know that it's imperfect. In fact, the extension to those who have bipolar disorder with psychotic features is a recent change. Our goal with both SB 43 and the CARE Act is simple: to offer care, not punishment, support, not abandonment. Finally, I want to touch on the Behavioral Health Services Act, formerly known as the MHSA, now the BHSA, as the cornerstone of California's public mental health funding. With the passage by the voters of Prop 1, we continue to prepare for significant reforms on how these dollars are allocated and used. The updated BHSA framework places much greater emphasis on housing, crisis care, and workforce development, ensuring that funding is aligned with today's needs. As always, we continue to engage community stakeholders, including NAMI chapters, to gather feedback on our 3-year plan and local priorities. Your voices are essential as we shape how these funds will support prevention, early intervention, and recovery across our system. In closing, I want to recognize the strength and heart of everyone in this room. NAMI has always been the bridge between the system and the community, reminding us that every policy, every program, every dollar must ultimately serve people and families living with mental health challenges. Together, we're reimagining a system of care that is equitable, responsive, and rooted in humanity. Thank you for your partnership, your advocacy, and your unshakable belief that recovery is not only possible, it's happening every day here in LA County. Thank you.
Thank you so much, Dr. Bonds. We're really appreciative of the LA County Department of Mental Health support and partnership. I don't know if you know, but we do get funding for our support groups and classes through MHSA and then moving forward, hopefully through BHSA as well. Now it's time for our breakout sessions, which start at 10:15. So you'll have about 15 minutes. Grab some more coffee, tea, pastries, restroom. Please refer to the program to learn more about each session. All of the Spanish breakout sessions will be in the Mojave room. If a session is full, please move to another breakout session. And again, we have the Calm room, which our peer support Warmline specialists will be there. It's in the Big Sur. And don't forget to join us back here at 2:45 because we're going to have an amazing closing session. Again, you'll have the opportunity to win 2 tickets to the Catalina Jazz event on November 9th. And please visit all the resource tables, including our NAMI GLAC table, which is right here in the hallway, and Dr. Wells' links are on that table as well. Lunch will be served in the courtyard, or if you prefer, you can come in here too, I think. And you'll have the opportunity to find out more about our support groups if you like during the lunch break. So again, I also want to, one last thing, we have our new marketing director or marketing manager, Sinead Hickey, who is going to be videotaping today in the courtyard by the NAMI sign. If you're interested in sharing your story or even just one word about what NAMI means to you, we're getting together communication for our year-end campaign and just overall marketing. So we'd love for you to visit Sinead during the breaks or during the lunch hour to share why NAMI is important to you. So with that, enjoy the sessions and we'll see you back here at 2:45. Thanks, everyone.